were simply marking 50 years. Celebration, marking. Of course, celebrations filled the air, some people found no reason at all to celebrate. Health workers maintained their stand that they will not resume work unless their services are placed under the national government. On the other hand, sick innocent citizens were left unattended, some unaware of the reasons for the strike. Others simply died for lack of medical attention. What is the way forward? Because this is actually the 7th day. I want to understand that, and to tell us more about that is Dr. Nelly Bosire, who is the Kenya Medical Practitioners and Dentists Union Nairobi branch chair. Welcome, Dr. to the Power Breakfast Show.
Thank you.
So perhaps just to reconfirm, this is the 7th day of the strike. The strike is still on.
Yes, the strike is still on. Yes.
So what is happening across the country? Any change from what we saw last week?
Not really. The situation still remains the same. The facilities are still closed. The health workers are still on strike. And the government has not yet made any attempt to resolve the impasse.
What, in your view, can the government do?
Well,
what do you want the government to do?
We have been talking with various government arms about this issue for a long time, even before we went on strike. So it's not an issue that has started being addressed at the point where we are on strike. What we felt was a problem was the manner in which the devolution of healthcare was handled. And we have tried to address this through various organs. We have tried to approach the transitional authority. We have talked, even various committees have been set up. The Health Service Committee has looked into this issue and they concur with us, the Health Service Committee in Parliament. So where we are at is a point where all the meetings that have been held to try and look into this issue have failed. So we are here, we are on strike not because we want to, but because we really were not given much of an option.
What is it that the Health Committee in Parliament agrees with you about?
That devolution of healthcare per se is actually not very, the way it has been done is not right. One.
What is wrong? Tell Manai to understand.
Okay.
What is wrong? Because if you are sitting at home,
yes,
and you're watching TV, you want to understand what's the issue.
Well, the Constitution is very categorical on how devolution is supposed to take place, right? And it's clear that devolution is supposed to happen under specific structures. Now, for the healthcare devolution, this was done without the structures being put in place yet. Yes, and key to this is two documents that are very relevant. One of them being the Health Act and the other one being the Health Policy. These documents are still in the process of being made. They are not yet even anywhere close to completion, and yet the services have already been devolved without any structure. So the budgets have gone to the counties. The counties are supposed to take over this facility. We know that the governors feel very ready to take on this, but we don't think so. So this is the issue we were trying to address and say the Constitution is very clear. It gives us a whole 3-year period to address this issue, to do it systematically, to do it right, because you do it once and you do it for posterity. And this has not been done. This is what we are battling with right now.
Health Cabinet Secretary James Macharia basically says your demands are unconstitutional.
This is because one of the things that we have been asking for and agitating for a long time, even before we went into the new constitution, which is even before the March 4th elections, has actually been the formation of a Health Service Commission. And if you look back, even at the point we were drafting our constitution, at the point of the Bomas draft, we had a Health Service Commission in the constitution. At that point, Wanjiku thought that healthcare was actually important enough to require a Health Service Commission. The draft went to Naivasha. Doctors, nurses, the healthcare workers essentially were pretty much a handful, and it was removed from the constitution. So as we were, since 2011, if you look at the various strikes that have been going on because of the healthcare, we have been requesting for this, saying we need to put a Health Service Commission in place. And this did not happen. So here we are in the new constitution that does not have an allowance for a health service commission as it stands now. But under the Health Act, we actually can get a health services authority, and it is one of the things that have actually been fronted, and this will look into regularizing the issue of healthcare workers. Because whether we like it or not, healthcare workers are not just any other civil servant. To just lump people under the Public Service Commission and say this is how we'll work is going to cause a lot of problems if we're not very clear on how healthcare workers should work. People who do services like ours, for example, the police, as you can see, have a Police Service Commission, and it makes management of this workforce much easier. That's all we're asking for, that the Health Service Commission is a necessity, and if constitutionally we cannot have a Health Service Commission, allow us to look into the Health Act. Let us do it right and let it make provision to look at issues of healthcare workers, which is the reason we are saying as of now we are not ready. We're not against devolution, and I think I want to categorically state this. We're not against devolution of healthcare as a whole. What we're saying at this point is that kindly hold back devolution of healthcare workers as a workforce and get this legislation into place, so that as we move into counties, we are moving in a way that we are not going to interrupt services. If you look at the healthcare system in this country, we have had a lot of problems. It has taken so much to try and stem the tide of, exodus out of this country, brain drain and all that. And one of the things that have frustrated healthcare workers perennially is lack of these structures. We have fought, before 2011, we didn't even have a doctors' union. Nurses have just gotten their unions, their Kenya National Union of Nurses license just there. The other day, it has just been registered the other day. And these are some of the things that these unions have just been looking into to ensure that once these structures are in place, they're here for posterity. So we can understand why some of these things went wrong. I would tell you that by the time we were doing a bomber's draft, I was just in medical school. I did not understand the intricacies of some of these things. But I'm here today, and I don't want to have to leave my country to go and give service elsewhere just because as a government we totally refuse to look at how best we can give service and keep things running smoothly.
Right. On Tuesday evening there was actually a meeting, and I understand there was a statement that was released that stipulated that development of health functions be postponed till February. Now, according to the Cabinet Secretary, he says, that is Macharia, he expressed his frustrations with the union, saying he sacrificed several hours in meetings with unions only for them to turn around and declare a strike.
First of all, I would like to make it very clear that we're not at war with the Cabinet Secretary. And even this Cabinet Secretary was aware that this was coming. It's not that the strike hit him by surprise. Okay? The meeting that was held on Tuesday, let me first explain its genesis. 2 weeks prior, there was a meeting at State House that actually was called by the President himself to try and resolve this issue. And various bodies were represented in this meeting to try and look at the way forward. And after various presentations from various categories of people, it was clear that there was no consensus. And what the President says is, I've given you 2 weeks, go and discuss this, build consensus, and then come back and let us see the way forward. Now, for 2 weeks, nobody calls this meeting. And wait until a day before we're supposed to give a report to the President. And then suddenly the Governor's Council is calling for a meeting to discuss this and say, now we want to have a way forward. And when you come, you're not making any consensus and you're still sticking to the same position. So whether we like it or not, that was too short notice to come up with anything sensible, because we had 14 days to meet, 14 days to have these discussions. Meetings have been going on in the office of the Cabinet Secretary. Even in his absence, the Principal Secretary has been in meetings with the union officials. And so I would like to say that this is not an ambush. Okay? We have looked at every avenue to try and deal with this. But I think the biggest push is really coming from the governors, who really want to take on healthcare And I mean, I commend them for wanting to do this, because a lot of them are in counties where they feel that maybe if they took over healthcare, that they can do things differently and improve service provision and all that, which is fine. But as we say again, structures, bottom line, structures, that's all we're asking for.
But those structures you're asking for,
yes,
they will be not done overnight. They cannot be done overnight, according to what you explained.
yes.
So if the government will now want to end the strike now,
yes,
tomorrow, what would you like the government to do? Because those things we're asking for cannot be done.
Our bare minimum is very simple.
Which is?
A gazette notice was issued in August of this year that actually devolved healthcare workers. Okay, we're just asking for a reversal of that gazette notice until at such a time as the appropriate laws are in place. We have a 3-year period. I don't think it takes 3 years to actually come up with the Health Act.
The gazettement, then the gazettement of that notice,
yes,
the cancellation of that gazette notice.
yes,
Already the money has gone to the governors.
it has gone to
So
the
you're
governors.
asking that the governors be asked to return the money to the central government?
As it is right now, every month they have to write a check back to central government to pay the healthcare workers, because this has been going on since August.
What do you mean?
So what they're saying, that until February, what the cabinet secretary is saying is that as of February going forward, then the counties are supposed to pay healthcare workers. Now, one of the things you need to look at is, if you look at how even the counties budgeted for health, majority of the counties, even their total budget is not adequate to pay the health workers for that duration of time that they have been given. So we understand that they haven't even grasped the enormity of how expensive it is to pay healthcare workers. And what is coming out of this, because they are grappling with trying to find a solution to stretch the budget, is that there is a massive slash of salaries that has been proposed. We have seen some of the county payrolls that have actually been generated, and some of the pay structures there are actually slashing salaries by up to 40%. You cannot tell me that that's not enough to cause a lot of discomfort among people who are giving service. Because as you look at it, the basic salary will not change, because that is still pegged on your job group. But healthcare workers, what they earn mostly is pegged on their allowances. Allowances that have been generated by the unique nature of their work. Now, for you to actually bring down this cut by 40%, you cannot touch the basic salary, which means that these allowances, which over the years we have actually fought for, have been slashed.
So actually your arguments on fear?
There is a lot of fear for a lot of things, and some of these fears are very founded. We know that there is a lot of tribalism that has gone on the ground, and it is very unfair that some of our colleagues have been dismissed, actually sent back to central government because they did not belong to the appropriate tribal grouping as to where they work.
But a doctor is a doctor.
Absolutely.
You
would think that's common sense, right?
Yeah.
That a doctor is a doctor,
A
and he
vet is a
doesn't.
vet.
Absolutely. But right now we have counties where some of the doctors have been sent away because they don't belong to those tribes. And that's a huge concern. And at the point at which governors are doing this, they don't actually realize that there are some counties that cannot even generate enough doctors from their own tribes to actually run the healthcare of that county. So when we start having these kinds of dismissals, transfers, arbitrary transfers, then how is a healthcare worker supposed to feel safe?
Right. We'll be taking in your questions. Send your questions. The number is 22422. That's 22422. Somebody is asking here, in fact, just a statement saying doctors should accept devolution amendments can follow. They're afraid of supervision.
We're not afraid of supervision, because the only person who can supervise a healthcare worker is the regulatory bodies that are actually constitutionally formed. Doctors are regulated by the Kenya Medical Practitioners and Dentists Board, okay? And this is actually provided for in the Constitution under Cap 253. So you cannot change that, okay? We're not scared of supervision because we're there as clinicians. And the only supervision you can actually give me is clinical supervision. So if my patient complains that I did not attend to them right, even the governor can do nothing about that. That is the medical board.